Every society leaves clues about what it values, not only in the laws it passes or the institutions it builds, but in the people it chooses to invest in. Children occupy a curious place in American healthcare. They account for a relatively small share of healthcare spending compared with older adults. They don't vote. They don't have political action committees. They don't lobby Congress. They rarely dominate policy debates or election campaigns. And yet, if we're honest, no population is more consequential to our nation's future. Today's kids will become tomorrow's workforce, tomorrow's parents, taxpayers, military, innovators, tomorrow's physicians, nurses, teachers, scientists, and public servants. They'll ultimately inherit every success and every failure of the healthcare system we're building today. That's why this conversation is not simply about pediatrics, it's about the future. Much of our national healthcare conversation revolves around insurance premiums, Medicare, pharmaceutical prices, hospital finances, shortages, the rapidly rising cost of care for an aging population. Those are all important conversations. But there's another question we don't ask nearly enough. What happens when we fail to invest early? What are the long-term consequences when childhood obesity rises, when anxiety and depression become commonplace, when preventative care is delayed, when families struggle to find behavioral health services, and when trusted relationships between physicians and parents begin to fray? These aren't simply pediatric issues. They're economic issues, educational issues, workforce issues, and ultimately national competitive issues. In many respects, children's health is one of the earliest leading indicators of where our country is heading. We want to understand what American healthcare will look like 20 years from now. We should spend less time looking at spreadsheets and more time looking to the physicians who are caring for kids every day. Which brings us to today's guest, Dr. Amna Husain, a board-certified pediatrician, physician leader, educator, one of the most thoughtful voices helping families navigate modern medicine. Every day she sits across from parents, making difficult decisions, caring for kids whose lives are increasingly shaped by technology, social media, mental health challenges, changing public trust, and a healthcare system under growing strain. She brings a perspective that extends well beyond the exam room. Today, we're going to explore what pediatricians are witnessing that healthcare executives, policymakers, insurers, educators, employers, and perhaps all of us should be paying much more closer attention to. We'll discuss the changing health of America's children, behavioral health, Medicaid, CHIP, trust in medicine, tech's impact on developing brains, the economics of prevention, and why investing in children may be one of the highest returns our nation can make. Because if children truly represent the future of the healthcare nation, then understanding their health isn't simply a pediatric conversation, it's a conversation about America's future. I'm Rick Gannotta, and welcome to the Healthcare Nation podcast.
Welcome to the Healthcare Nation podcast. We're committed to bringing you thought leaders in the field to discuss what's new and noteworthy in the healthcare sector. Now your host, Rick Gannotta.
Dr. Amna, it is so good to have you on the show. I've been waiting, to really, tackle the question of children's health, pediatrics, what's happening with the state of, I think, so much of the impact of social media on kids. We've got a lot to talk about. Let's just jump into it, because I think if there's any one question I want to start with, given your perspective and obviously your unique position, from where you sit, again, from your perspective, if we look at America's children today, are they healthier than they were 15 years ago?
I think yes. I absolutely think so. You have to look at this from a bird's eye perspective. And I will say that as a pediatrician, we live in the field of primary care. Preventative, being proactive, not retroactive. We have to think of how much we have learned. So we learned so much about screens, internet. Okay, pulling it back, giving it forward. Where can screens help? Where do they not help? In terms of just generalized safety, helmets, sunscreen, seat belts, all of these things are things that we know so much more about when it comes to children versus 15 years ago, 20 years ago. And we can always go back on that perspective of, in my day, this was this way. Of course it was that way because we didn't know any better. I think we know so much more now. And in some ways, and I do this as a parent too, there's a lot of information out there. You can't hit A+ on all the things where you're never using screens or you're always doing organic or you're never doing dyes. But we have a perspective of being able to, I can control that this is important to me and my family or me and my child. So I'm going to add this in, not add this in. So we're healthier, but I think we're also having a more balanced perspective on things as well.
So along those lines, if you had to say, and by the way, I'm really pleased with your answer too, because I want things to be directionally positive, and that's fabulous. But what do you think? What surprises you or concerns you the most? Which you wish there was a reset, or we could do better on, or we need to address?
Generally, I think just fields related to children. If you don't realize, unless you're in that field, but teachers, pediatricians, school counselors, social workers, daycare workers, all of these fields are focused on children. And you might see that just commercially, economically, it's not a very big representation. It's very low paid. There's not as many just generally advantages to working in that field. And so it takes a very dedicated, passionate person to go forward in this field and say, I really care about children's lives. But that field is quickly becoming overshadowed by just generally having to live in the society. You need to pay your bills. Right. So we're finding more and more teachers leaving the classrooms and becoming tutors one-on-one, because yes, of course they love working with kids, but they also need to pay their bills. And as we're finding out that a lot of these fields with children, they're not funded enough. They're not paid enough. They're not appreciated enough. And people are noticing that. Yeah,
I really appreciate that you're thinking even beyond, the four walls of the healthcare system writ large, and thinking about, the impact that teachers have and others in the profession, where they're taking care. We entrust our kids to them. And, my wife's a teacher, worked for many, many years, and I know she had such a great affinity for the field and the people who worked in it, and it really is an extension of everything that you probably do clinically out into the real world. Let me pick up on that and just ask you if you thought about, not that I want to categorize it, because we clearly have a lot to cover here today, but do you think that the challenges you're seeing today, are they primarily what you might see in regular physiology? Are they more, cuts, strains, or are they emotional, or are they social issues? Or has things kind of oscillated, or has any one area gotten more of an uptick than another? I guess another way to put it is basic primary care, one thing, coughs, cold, chronic issues, versus emotional or social issues.
Yeah, I think the best way to address that is we're seeing all the things we saw 15, 20 years ago and more. And I will say that in that people bring different perspectives. So let's say it's the common cold, and you find a family that would like an antibiotic for a viral illness. Sure, we still have that situation arise. We still have those discussions. And on the flip side, we have a bacterial illness and we need to give antibiotics, and families do not want to do that. So we have all of those same discussions that we used to have, and other things such as mental health is becoming much more prevalent. I can take you back to, being a high schooler myself, right? So we're doing all these different math courses. People are doing extracurriculars. People are trying to, prep and get their college resume all ready. And now when I think of our babysitters who come through the door, this is a very anxiety-provoking situation for them. And it was, of course, anxious to apply for colleges, to think of your next career step. But I'm seeing these kids, it's really fundamentally affecting them on a physiologic level. If your sleep's impacted, your diet's impacted, if your ability to focus, because let's say you're having anxiety about a certain situation or depression about a certain situation. I think mental health has taken on a much larger concept. And that is also just going back to my prior answer where you feel the crunch. 20 years ago, you could do a pediatric appointment maybe in 20, 30 minutes, depending on the age group, if it's a well check. But now parents are more educated, ask very good questions, of course, with the onset of the internet and being able to look up things. Very good questions. And you want the time to address those questions. You want the time to talk to your patients. And mental health concerns are not something you can wrap up in 5 minutes. So that's where you feel the crunch, I feel like, as a healthcare entity, but then also just looking at your pediatric population.
Wow. This is a loaded question, but I'm gonna ask it to you because I think it tells a lot. If children are the leading indicator of the nation's future health, what's the story that they're telling us? What are they telling you when you see them?
I think we are potentially asking our kids, I don't want to say grow up too fast, but putting a lot of pressures on our kids very early. And I say that from the onset of just careers and getting our kids to think about those next steps. And I say it in this way, the idea of doing a job over the summer to make a little extra cash, it's not just about that anymore. You're doing a job during the school year to look like you are prepping your resume for being able to manage your time and different. These are big things that we're asking our kids to do, take on additional college courses and credits. And it's not only just that we're asking them, but they are looking for it because their peers are doing it and they don't want to be left behind. I think that is asking a lot. What is the hurry? What is the rush to get all your college courses and credits done with? What's the rush to add another thing onto your resume, add another sport, another course, another job? If we're asking our kids to multitask very early, checking your emails. I mean, I did not have an email address in high school, and I understand that technology is taking off. I do, but then our kids are then being pulled in a different direction. Once they go home, they can't really unwind and unclick that off.
And I've always thought, one of the worst things we can ever do to an individual is rob them of their childhood.
Yeah.
Or keep them from effectively maturing into an adulthood.
Yeah.
And I think what you're saying in some ways is really hijacking a lot of what we, or at least what I grew up, being able to experience as a kid.
Yeah. And I mean, I think I have to be very fair to parents here too, is that it's not something that we're doing in our households. It's exposures we can't control. If my kiddo's on the bus and they talk to someone else who already has an iPad and is already buying different things, my kiddo doesn't have that option yet, does not have that responsibility, that privilege, and I choose not to, but they see other kids do it. I think that's one thing that I think our kids are potentially getting exposed to growing up, and also just generally being put in positions to make decisions and think ahead before they're quite ready to.
Let me kind of expand the conversation here a little bit, and I'm going to use something we talk about probably way too much on this podcast, which is vaccines, but I'm going to use that as a proxy for trust. And really what I would say is the relationship between families, in this case perhaps parents, and medicine, and you as a pediatrician. And I don't want this to be a conversation, this part about it being about vaccines, but really more about trust. But let me ask you this, when it comes to that, and again, I think the whole issue with vaccines is a great proxy for that trust issue. Has confidence changed when you see parents coming in? And how do you manage the conversation? How much of your office visit ends up being about education versus persuasion?
Yeah, I think this is going to vary person to person. One part of healthcare is burnout and moral injury, and we self-sacrifice quite a bit. In my field in particular, kids hold a very dear place in our heart. A vulnerable population, we are part of that medical home. We are part of that home that nurtures not only the child, but also the parent. So you look at it with that perspective, but also the perspective that there are all types of patients and families that come through the door. Some are very confident in their decision, and there is nothing that you can do to change that. And you have to create a boundary for yourself then. That boundary could be, I will not see patients who do not vaccinate. I will potentially see them on to the age of 1 year of age, or I will work with them and we will do a altered schedule, delayed schedule, and or I will see them, but every time they're sick, I have to send them out to this ER. There's all types of different ways, and I think that's pediatrician dependent, practice dependent. If I own a business and I have a practice of 5 pediatricians and we all have different rules, that's kind of not sustainable. So I think generally the confidence question as a whole, that's different. I just want to talk about like how I would approach it and how I approach parents usually. You get a gestalt on a patient and you understand if this patient is willing to learn, be interested. You can provide resources, come to you with certain questions. I think that's absolutely something that I would be comfortable doing and talking to them. But if it's somebody who's not comfortable at all, does not want to change their mind, I usually let them know that, maybe we don't have the same values. Maybe we don't have the same vision. And this is very important to me. But that might not be the case for every doctor, every pediatrician, every primary care physician out there. And that's fine. I have to accept that I'm not the doctor for everybody. Now, the confidence question. I think confidence in vaccines, I think if anything, it might be a little bit more, sure, it waxes and wanes, it goes up and down. I think especially post-COVID, we have developed a strong pro-vax population. Before, it used to be everybody gets vaccinated, sure, and we have a loud anti-vax community. And now I think we have people who are pro-evidence-based also being added to that party. People who are really choosing to get out there and say, no, vaccinating is very important for my child who can't get vaccines because they are on chemotherapy. Please think of society as a whole. And I want to be very careful that this is not shaming people for their beliefs, but just generally, I think you have to understand that confidence is going to come with all different people who are very confident and people who are go with the flow, maybe just be like, yeah, I'll get vaccinated. I was vaccinated. I'll be fine with it. And then people who really don't feel comfortable. I think, on a perspective that things are positive, I do feel like pro-vaccination, pro-evidence-based medicine, it is in. It's popular, especially post-COVID. People want to know the facts, and they are choosing to follow public health officials, choosing to educate themselves on who exactly is the health secretary and the surgeon general and what are their credentials, that kind of thing.
What does vaccine hesitancy reveal about the relationship between patients and, the providers, you as a pediatrician, but I'd extend it even beyond that for folks when they're looking for truth in this post-truth world?
I love it, actually. If you feel comfortable talking to your doctor, that's great. We want to feel approachable. I talked about the time constraints, and that's not always, dictated by the physician who's seeing you, unfortunately, especially if you're working for a large healthcare system. Those are things that are outside of our hands. But if you have that relationship with your doctor where you are able to bring up your hesitancies, your concerns, and your questions, that's what we want. That's what we're here for.
Do you, in the folks that you see in your practice, but even beyond that, I think that, and look, you have a big profile on social media, and you're a leading voice in the field of pediatrics. Do you think that institutional trust in medicine is eroding? Where do you see it now? We talked a little bit earlier about there's now a pro-vax side that you're seeing. I think that's good. But do you think overall institutional trust, and I'll just dial it up to even the CDC, FDA, what are your thoughts on that?
I don't think institutional trust is eroding, but I do believe that we are in a society where Insta and Tele is just so nice, right? I don't have to get up from my couch when I feel bad. I'll just go One Medical, Amazon One, order my, who are you seeing? Is this person able to conduct a good exam for you? These are the things that I think of as a physician, why I would be hesitant to fall for the easiest and quickest solution, because medicine is nuanced. I think there's a place for telehealth. I think that we as a society, the instant fix is really nice, and sometimes that's just not possible when it comes to medicine. I don't think trust is eroding. I think that medicine is not going to be able to provide that instant fix that people are used to with where we are right now.
And increasingly, I would say, younger folks, folks in your job, they want it now. I want I want the answer now. I want that instant answer, instant gratification, and completion to whatever question I asked.
Right. And it's nuanced. It's not always like that. You can, put into ChatGPT your symptoms and something will arise, a differential, but they could be completely off because they don't quite understand what your rash is, or they don't quite understand the constellation of your symptoms. And something that you might not consider a really big, important part of your history might actually mean a lot to us when it comes to creating a differential. I think that that's where, I wouldn't say that trust is eroding. I think that the goals and the vision of what general society is wanting is not going to always be met by what medicine is and what it's meant to be.
Yeah, and I want to switch into the policy world, because some of the areas that we're touching upon really easily fold over into that area. Yeah. And I've thought for a long time that children, and we know this in research and even beyond that they're probably the least represented constituency in American healthcare, for sure, right? They don't vote, they don't lobby, they don't have a PAC. The voices that they have representing them, their parents, obviously have their own views. Yet investing in kids is probably the best ROI, return we can have for any healthcare investment out there. All that said, I really wanted to get your views on what you're seeing and what you're thinking about in the field in general, say Medicaid and CHIP. I think the majority of kids right now in the country are covered by Medicaid. And I mean, it's a staggering number. The behavioral health access question, we talked about that earlier. Getting that covered alone is a big issue. Let's just start with those two areas alone.
Yeah. Okay, so this is a institutional problem. This is a systemized problem, because you think of who the patient is that is needing Medicaid, needing CHIP. These people are absolutely depending on their insurance, medical insurance, to get their care taken care of. Behavioral access. You find more times out of not that many psychiatrists and mental health providers are going out of network, because the reimbursements are so low that to hang a shingle it's not possible really if you work within the confines of insurance reimbursements. Now they set a cash pay rate and Medicaid is not able to pay that.
Right.
Or the patient who's on Medicaid, is not able to pay that. On that note then, so what do? They have to go wait for someone who's in network. And these wait times can be years long. Years long.
Years.
I had my own kiddo once need to wait to see a developmental behavioral pediatrician. The wait list was 3 years.
Oh my gosh. That's
3 years.
Incredible.
So I paid out of pocket and saw somebody who was able to see her within the next month. But let's look at, for example, a developmental behavioral pediatrician.
Yeah. You're developing over 3 years. Yeah,
I mean, my 2-year-old is then going to see this kid when she's 5.
Yeah.
So let's take, and that's not because there is this doctor's like outrageous. No, it's because there is just one doctor to see all these many patients. Something has to make sense dollars and cents wise for the physician too.
Right.
Yeah.
And the number, by the way, just looking at the stats, I think 2023 it was peaked at like 43 million children insured through Medicaid. That represents like 58% of all insured U.S. kids, and half of U.S. children rely on Medicaid or CHIP for their health coverage. So it is something that's baked into the system. I talk about it a lot from a policy perspective, but what I'm hearing from you is the other side of it is, and I want to be pragmatic, from a business perspective, if you're a pediatrician, if you're a pediatric psychiatrist or psychologist, and you're seeing folks, you're literally not getting the level of reimbursement you need to have a sustained practice if you're going to take 100%
I mean,
Medicaid.
this goes for pediatricians too. I will say a lot of, subspecialists, cardiologists, you think make a lot more, endocrinologists make a lot more. That's in the adult world. There are some pediatric subspecialties that will actually make less than a general pediatrician. So I'm going to paint a picture. They literally did more training. Right. And they are getting paid less. That is ridiculous. Yeah. And so I think it really comes down to the value of children. It is a systemized problem. It just, if you want people to go into that field, you need to start respecting their work and their value and what they bring to the table. Just like you said, investing in the future generation.
Yeah, and I don't want to go too far afield here, but I think from a workforce perspective, we know that we've got a shortage of physicians coming out.
Yep.
Certainly nurses, I think 3x of where the doc situation is. So a big crisis in both areas. But if you thought about how that trickles over into pediatric care, again, pediatric nursing, subspecialties, NICU, et cetera, on up to the physician side and specialties, I think we're seeing the same level of shortage, maybe even worse for the pediatric side.
Oh, yes. Every year it'll come out, in terms of which physicians matched in which specialty. I believe it was 2025. We had multiple spots for pediatrics go unfilled. And it's not because people don't care about kids. Trust me, they do. We are all still here. You'll find a handful of people who are still very passionate about it. But you have to see in this economy too, it has to make sense.
Right.
And I don't blame them. I don't blame them. I get it.
Let me talk about we mentioned earlier some of the investment side of things. If you thought about preventative investment in a perfect world where, let's just say, you could get the reimbursement you need, and we could get the kind of funding required for a platform that's very different, what would early childhood investments look like to you if you said, this is what we should focus on so that these kids can actually become happy, healthy adults, high income earners, workers, et cetera?
Yeah. Okay. So I think we break it down by age group. In that 0 to 3 age group, that is a very important time when you're looking at developmental milestones, right? And how fast the brain is developing. That is the time that we make, and thankfully many states do this, but we make healthcare accessible in the way that they are able to easily get to their appointment. I used to work in DC. That was one very hard thing. Get to your appointment, but then on that note, if something comes up, your child doesn't meet all their gross motor milestones, able to get physical therapy very quickly. These are all things that are set into place by the state, but for some patients, all those barriers along the way are very difficult. Mm-hmm. So for example, being able to go to your doctor, qualify for physical therapy, all of those things. So you are able to 0 to 3 qualifying for your therapies if you are delayed. When you're looking at 3 to 5, 3 to 6, that's starting preschool age group. That's talking about your readiness for school. I think a lot of families don't know some of the skill sets that are very important at that time. And that's because you might find that that's that in-between age group where they might not be ready to start school yet, especially the 3, 4, 5. Parents are at home, perhaps. It might be a single family household, and they are not aware of all the school readiness skills that are out there. I think that's the other part too in that age group of 5, 6 under is childcare. Childcare is one big problem. So if you could do one thing that I think that would also support is childcare. You have parents who are burnt out. You have, like we mentioned, daycare providers that are burnt out, but also like daycare, childcare is a very expensive field.
If you've looked at new models of care, if I could characterize it that way, is there an opportunity with school-based health centers playing a bigger role if you thought about primary care, the behavioral health side, some of what we are trying to do? And you mentioned it, the access piece, to kind of break down any kind of barriers for transportation, the missed opportunities for parents if they have a competing job issue versus taking their kid to a doc, that kind of thing.
And they used to do more of that, school vision screenings, hearing screens, dental.
I actually remember them.
Yeah, yes. dental access. There used to be so much built into the school system, and I'm not an expert on the school system, so I can't say why that policy was taken away, or some of them aren't as embedded in. But I will say that then depends on. I'm going to bring an ugly side to this, is just school support. My own daughter's school, she has asthma. There's not always a nurse on hand to give her the asthma medication she needs, because that nurse is now supporting a couple of other schools.
Multiple schools. Yeah.
So if this is going to be a more school-based health center, then we have to turn around and start investing in the school system. Yeah. It all builds on top of each other. And unfortunately, once you uncover one, one corner of the rug, you'll see all the dust bunnies underneath it. There's a lot of things that we put Band-Aids on. But if we're going to ask the school system to do this, which I think is a wonderful idea, the school system does so many great things in terms of providing meals for children who need them, providing that resource, counselors. Like I'm the medical home. They're a completely different kind of educational home for the child. Then we need to provide them with those resources.
Yeah, but it gets back to what you were saying earlier in terms of the funding piece that, or the lack thereof, even on the educational side. And if we don't have enough money for teachers, then where does the school nurse come in the hierarchy of that calculus and equation? So I mean, really tough questions, certainly policy questions for the state. I want to get to what I think might be, certainly for me, or probably many of our listeners and folks who follow the pod, the question that they have when it comes to kids, and that is social media technology on the developing brain. And I'm saying the developing brain because, obviously children, but I don't think it ends there when we think about perhaps even up to the third decade of life and how the back of the head comes together with respect to neural pathways. And I'm not an expert in that. But we've never allowed a $1 billion engagement funded algorithm interact more with developing brains at any time before in our history. It's probably the biggest social experiment ever. I hate to characterize it that way. What are you seeing? What is this attention economy doing to these kids? You mentioned the anxiety side, but are you, and I think even sleep, but how about loneliness, depression? Is that coming through as well? And I hate to say it, what are parents doing? Are they enablers, or are they, and I'm just going to put that out there too.
Yeah, good question, loaded question, good question. And I think that you said it. We know that this is a ugly part of the internet. Social media can bring really great things, but then it also brings with it, just like you said, the attention deficit. We're used to Insta, scroll, new thing, read a little bit, move on, next thing, swipe, and life's not like that. Sometimes you can even look at the cartoons. Things are, the way colors are changing, screen captures are changing. The attention piece is a tough one. It also doesn't help that many of our work-based, homework, school-based activities are also sometimes now moving to screens. I think it's certainly across.
You mean literally the school-based activities? So
Yeah, I mean, kids are going home with Chromebooks, right? Checking their email, doing their homework, submitting it on Canvas, not the way that we used to do it. And I think that's just the new reality. So that you can say social media is one part of it, but also just being in front of technology is another part of it, right? Where it's a completely different way than pencil, paper, which data has shown us actually helps more with rote memory. So I think you're right. It's a social experiment that we are now seeing the effects play out in real time. And it's not an easy answer because every school is different, but also parents have different perspectives. So I'll tell you, alone for just Wake County, there has been a big push by parents to limit how much technology is used. And that would not have even been there 5-8 years ago. So parents are pushing more and recognizing more about these potentially detrimental effects that it's having. We don't even have to say it's anxiety or depression or attention deficit. It's just that I don't really want my kid being on this to get their assignments. I'd like them to submit them in a different way, and parents are pushing for that. And I think that there is a good side to that, but then also a bad side. These technology, being able to send home a Chromebook is to help prevent that digital divide that we see.
Now, I was going to say, the other side of it is if we do not give young people, starting with kids, the requisite skill set needed to be able to navigate a world that is going to increasingly, it's already there from a technological standpoint, and I think in 5 years it's going to be vastly different than it is today. Then I think you got to balance that out with any kind of harm that's being done.
I think, yes, and you know what? The other aspect is you'll see it. Parents arguing that this gives your kid an advantage because this technology is here to stay, but then the other aspect is they'll learn typing. They
Yeah.
will. They'll learn how to click. But does it need to be introduced this early?
Yeah.
And I think that is the nuanced question that now we are facing. COVID very rapidly put education on a digital platform.
Mm-hmm.
And then it became a almost ease of distribution. And now I think we're coming backward and trying to reel it back in. I can only speak for Wake County, but this is state dependent. This is county dependent. This all depends on each school system, all of those things.
Yeah. Differences between boys and girls, male and female?
I think that in terms of, for sure girls, there's a big stigma that's always out there in terms of the comparison game. I think absolutely.
And we're talking about kids here too,
yes,
right?
we are. And so that's why there's certain rules that you should absolutely not have your kid having a phone before the age of 13. You should not have them having social media apps before the age of 13. These are all things that have been thrown out as different rules in households. But enforcing it is all dependent on the caregiver in the home. And that is tough. You're right. So it could be the comparison game for young girls, but also for young boys. It could be the fact that they don't have a phone and you're sitting there with your group of 4 or 5 friends and they all have phones. Mm-hmm. So not only are you then you're comparing yourself to all your peers in the room.
And they're isolated and separated and not one of the group. And I think the other pieces of it, certainly, I think on the young kids, the boys, perhaps gaming could take them down into another world that leads to that isolation, and also a lack of reality-based learning. I mean, for a lack of a better way to put it, that's something that I've thought about for a while, because when the representation of a virtual world is so far afield from what they're going to actually experience.
Right, and I mean, I'll take it a step further. Is vlogging. Mm-hmm. Vlogging is. Not only is it easy, it's everywhere. So then you're actually sharing parts of your day so frequently with a digital community that it didn't used to be a part of our life and our lifestyle before. And now, as a pediatrician, as a parent, you're thinking of the safety aspect, but you're also thinking of the social aspect. Yeah. Here I am sharing all these important events with my digital followers, my screen.
Everything that was backstage is now on stage.
Yeah. And it's just normalized. Mm-hmm. Vlogging is so normalized. Get ready with me while I do my homework. Get ready with me while I do that. It's just, I think, and this is a big part of just sort of my MO as a pediatrician, is just protection of that age group. That age group, sometimes it's hard to wrap your head around just how much safety and information you're putting out there, how much of your privacy invasion. And I think that's the tough aspect of it.
Yeah, and when you hear these stories of bullying and tragedies that have occurred because of that, it is a lot of what I think you're saying, that exposure of parts of your life that should have remained private.
Right. Yeah. Influencer is a job now. Mm-hmm. That's what people want to do. They want to strive for it. And with that power comes great responsibility, and some children are not ready. Some teens are not ready to take that on. And I think that my job as a pediatrician is, working with that I work with the Council of Communications and Media for the AAP, is recognizing the safety aspect for children. Mm-hmm. And nobody may have asked, John and Kate +8, did you, about the privacy of their kids. But that is becoming a very real thing now for our TikTok influencers and our families. Is like getting consent from these kids, because you are really publicizing their lives before they're ready to do so. Right.
Yeah. I mean, that's we've seen a little snapshot of that with childhood actors. I think.
Yes.
And some of the really, many times tragic, other times not. But how that exposure of their life is clearly created issues.
Yeah.
And I think that not enough folks probably are aware of the scale to which some of these social sites go.
It's a deep, dark, ugly world. Mm-hmm. I'll put it that way. I mean, you have there's children on YouTube who are making millions.
Yeah.
And power to them if that's what they choose to do with their family's blessing and their parents guiding them and all of that, looking after their safety. But I know that as a parent, there are certain lines that I choose not to cross yet. And I think that that's our important thing, is raising awareness of these are all aspects and things that are controllable as of this time that we can help guide our children in.
Let me bring us home with something that obviously is related to what we were just talking about, but really goes back to some of the notions we said earlier. If today's children are going to become tomorrow's patients, tomorrow's workforce, tomorrow's leaders, right? The folks who our healthcare system is going to be paying attention to, because whatever they grow into and the problems they have, that will be some of the issues we'll be dealing with that large population. What trends or are you seeing that concern you and that we should be aware of that are going to unfold over the next decade?
I think just like kind of some of the things in terms of technology that I mentioned would be like, I think we don't realize how much vlogging kind of romanticizes the everyday life that we may not actually, our everyday child may not see or have, and that makes them feel like they are missing out. Not only just FOMO, but also just feeling like I don't have enough. It's the scarcity kind of illusion. I think that's one trend that we're finding. I see it all the time in my own house. No, you don't need another squishy. Nope, you do not need another squishy. But I think on another more positive note, one trend that we are raising more awareness of is generally just where screens can fit in and how they have a benefit. Certainly digitalizing your family calendar, that can be very helpful. Chore charts, photos, that sort of FaceTime, all of these are really positive things. Social media can be positive, can be negative. And I think that's where I see our trending sort of vision, is that people are realizing that it's not all good. It's not all good. So, you can still have technology, but you can balance it.
Right. I think if you had grandparents who are in another state and you say, hey, let's get on FaceTime, that is obviously a positive.
Yeah.
But, the same could be said for, wow, I'm looking at, the classmates and they have X and I don't, or they live, in this area and I don't. And that creates that anxiety divide and more of that isolation. It's kind of that both sides of the issue that you're speaking to. And
just to put something else on parents, then you start having to think of, well, I want to find friends who are like-minded. So my kids, we in the COVID days, we used to call it like a school pod or something, right? So we'd all get together and we'd do school at home rather than being digital. So now we're thinking of trying to find friends who are phone-free until 13 so that my kids don't feel like they're the only ones. And I think that's how parents are thinking now.
On the investment side, if the U.S. healthcare really came to the conclusion that children were our greatest healthcare investment, what would they be investing in?
Oh, universal parental leave. I think, that would be, we are so behind on the ball game when it comes to look at Europe, look at all these nations where they're able to provide support to after a baby, that for the mom to be able to get extended benefits, the father to be able to get a family unit to be able to really take that time and heal emotionally, mentally. And that is something that this country in the U.S., we do not focus enough on that. And I'm not just saying this as a pediatrician and or as a parent, but that is something that, going back to your mental health discussion, this is a very trying time for so many families. And this is a benefit that should not be, just taken for like a privilege. It's something that should actually exist. It's so I think universal parental leave is incredibly important.
And that's a straight up policy issue. That
is straight up policy. I mean, these are parents who, I'll lose my job if I don't come back in 6 weeks. And then you're forcing yourself to find daycare. It's a domino effect. It is then how am I going to pay for my daycare bills? I have to work more. I see my child less, which means that then screens. Like this is all a domino effect. And the stress, how it trickles into parenting, and then it trickles into your behaviors with your children. Mm-hmm. Oh, yeah.
Let's bring it home. My final question for you. What is the one message that you want to leave healthcare leaders, the folks in the sector, the policymakers that are out there, the hospital executives, the payers that are out there, and the other physicians? What do you want to tell them about America's children?
So you probably heard this before, but children are not small adults. They have their own medicine. They have their own physiology. They have their own unique set of problems. And that comes with a lot of responsibility, a lot of training, and a lot of love and dedication that go in there. And I think that couldn't be overstated enough. To bring importance to that children are the next generation. You are investing in those same problems that we are working our butts off to fix. Mm-hmm. Obesity in America, diabetes in America, chronic health diseases, autoimmune diseases. This is a chance to invest in that generation very early. The digital divide, all of these things that we've just briefly hit on, but that are deep-rooted systematic issues. We are having the chance to invest in that very, very early and have that play into effect very early on to create a trickle-down effect.
Fantastic answer, and I really hope that it's something that I know our listeners are going to take to heart, and those who can should get out there and do what they can, because, as you said, they're not just little adults. These are folks who are special in so many different ways. We don't want to rob them of their childhood, but also want to make sure that they're able to be productive adults who have a world that is healthier than the ones that we're experiencing as adults.
Right.
So with that, Dr. Husain, thank you so much. This has been a great conversation, a delight to have you on, and we look forward to having you back.
Thank you. Thank you. I appreciate that.
And thanks for everyone for listening to the Healthcare Nation podcast. Opinions expressed by the host and guests are for informational purposes only and not associated with any companies or academic institutions. Please follow us wherever you listen to your podcasts, as well as our YouTube channel, Healthcare Nation Podcast. And if you have any questions or want to contact us, please reach out to healthcarenationpodcast.com.